Welcome to Everyday Extension, the podcast that connects you to the resources, knowledge, and expertise of your local Extension office. I'm Justine Johns, your main host and livestock production agent with the Central Kansas Extension District, here to guide you through a variety of topics that impact our industry and communities. Here at CKD, we take pride in being a part of the larger K-State Research and Extension system, a network dedicated to serving the entire state of Kansas with research-based information and community-focused programming. From livestock and crops to horticulture, 4-H youth programs, family resource management, and community wellness, this podcast pretty much covers it all. In each episode, we'll bring you practical advice, expert interviews, and usable tips to help you tackle challenges and make informed decisions, whether you're in the field, in the garden, or around the family table. Thanks for tuning in, and welcome to Everyday Extension. Let's dive in. All right, everybody, welcome back to Everyday Extension. I'm Justine Johns, your host, here today with an episode and some individuals that I'm really excited about. One, because I get the chance to interview or put on the spot one of my old meat science professors from my undergrad days. And two, because we're diving into a growing health concern that's affecting more and more people every day, especially in rural areas. And that is alpha-gal syndrome. So you might be wondering, what is alpha-gal syndrome? That is the red meat allergy triggered by a tick bite, and it can completely change a person's diet and lifestyle. So to help us unpack this topic, I'm joined by 3 experts from Kansas State University who are leading research efforts to better understand alpha-gal syndrome, or AGS. We have Priscilla Brennis, a nutritionist and wellness specialist, Dr. Michael Chow, a meat scientist, and Dr. Yoon-Sung Park, an entomologist. So together we're going to talk about the science behind AGS, latest research and what's going on, what people can do to protect themselves, and whether you've been affected by AGS, know someone who has, or just want to learn more about this fascinating condition, this episode is for you. So we're going to get started. I'm going to start pretty broad to give our listeners a little insight into who you guys are, because I know you all specialize in different areas, but you still play a different but equally important role in this project and have something to offer that's kind of related to your field. And it's kind of a fascinating dynamic to me. So I want you guys to start off and maybe introduce yourselves, who you are, the basic background, how you got into your field, and really the main role that you play in this project.
I can start. My name is Michael Chow. I'm currently an associate professor in animal science at Kansas State University. And like Justine said, I'm a meat scientist. The two of us knew each other way back in our Chico State days. That was a lot of fun, but time has passed quite a bit. I've gone old since back in the day, and I didn't even recognize her when she first emailed me because of her different last name. So time definitely have fly. So I'm a meat scientist, and my main role is in teaching and research. And I teach a lot of meat science class. And what I have happened to notice is that in the past 4 or 5 years or so, I have noticed a significant increase of people that have come and talked to me about they are experiencing or know somebody who has this red meat allergy, or also known as alpha-gal syndrome. That is really when I start looking into this problem more and more. And then I start learning this is really a pretty common issue here in the state of Kansas. For example, one of our graduate students has it. One of the accountant in our department has it. And even Dr. Park's department head has it. So as a meat scientist, I really worry about that. This is a job security issue, because with more and more people not able to eat meat, then we'll have a bigger issue of having less meat production because there's less demand for it. So that's how I really got interested and start diving into this particular issue. And so I met Dr. Young-Sung Park through a biochemistry seminar that he talked about the alpha-gal syndrome. And he and I began talking about it immediately after his presentation, and to design a project that what we can do to help Kansans that have alpha-gal syndrome. And then the two of us realized that the first step that we gotta do is to understand the prevalence of alpha-gal syndrome in the state of Kansas. But none of the two of us actually have any experience with surveys, particularly surveying the rural community in Kansas. That's how we could connect it with Priscilla, that she has done quite a bit of work in that area, and she also knows the nutrition very well, and she's in family and consumer science. So the three of us really get connected and come up with this particular project. And my job as a meat scientist on this project, I'm the main PI. I am the one that organizes and facilitates all the different minute things that happens in this particular project. And my main role on this project is to quantify the amount of alpha-gal in different food product. So our goal is to really create a food database that we can basically have people just click into this food database and find out what each different product, how much alpha-gal it actually contains. So this way, people who may be more sensitive to the alpha-gal syndrome can avoid anything that has alpha-gal, or people with less sensitivity to alpha-gal syndrome, they may look at this database and look for something that has lower level of alpha-gal that they may still be able to consume.
Hi, my name is Yun Sung Park in Department of Entomology at Kansas State University. My research has been mainly in tick physiology and tick molecular biology in terms of pathogen transmission, and now expanded to the causal factor of AGS. So we have been working on like about 7 years now, and I'm excited to have like working with Dr. Chow in terms of the research direction more practically applicable in the field. So client-driven research in AGS can be implemented in my research program as well. So currently, just as a collaborative activity with Dr. Chow, just it's like more extension activity and outreaching activity in AGS is one of the major. And also at the same time, in my lab, some of the research has been more expanded to approach the practical solutions for AGS patients.
Justine, thank you for hosting us. My name is Priscilla Brenes, and I'm an assistant professor in food nutrition, dietetics, and health. I'm also the nutrition state specialist for K-State Research and Extension. And my job is mainly in extension and research. So I collaborate with other professors in research, but I also do a lot of extension work, and I provide help with the leadership of statewide programs and also help by training extension agents in different areas related to nutrition and health. So when I started this job, I think about a year and a half ago, I had some extension agents reach out to me and ask me about resources on AGS for people related to nutrition. And I was like, okay, let me look what AGS is because I wasn't very familiar with it. And then I started looking into it. But then also Dr. Chow reached out to me and said that they wanted to do this research. I was like, oh, this is like perfect timing because in the field, we have extension agents that are starting to voice the concern that there is a need for this type of education in Kansas. So that's how I joined the project.
I really love the dynamic, and I'm especially obviously a little bit partial to the extension portion of it just because I am extension, and I really love the role that you play in this, Priscilla, in being kind of the connector between the research that's going on and how do we get that to 105 counties? How do we get that to our Kansas people, which is really what extension is all about. And that just is awesome. And I really love the part that you play in that. So we're going to start, I'm going to back up just a little bit for anybody who's really listening and has no idea even what alpha-gal syndrome or AGS is. Can somebody explain what exactly the syndrome is and how it's going to affect someone's daily life and their diet?
So alpha-gal syndrome, also known as Remy allergy, that's probably the more common name to it. it's by definition, when somebody consumed red meat product, then they would develop some type of allergic reaction. But the main thing that's actually causing this particular allergic reaction is this carbohydrate, that's the galactose, alpha 1,3 galactose, which is a carbohydrate that's bound to the proteins or the lipids in mammalian products. So the funny part is that human beings, we're the only ones, and all world primates, we're the only ones that actually don't already have alpha-gal in our system, while all the other mammalian species have them in their system. So what happened is that we have these ticks that are known as the Lone Star ticks in the state of Kansas, that when they feed on us, what happened is that over time, that they will inject a high concentration of this alpha-gal into our system and then trigger allergic reaction. And so when people's immune system is being sensitized in this way, then whenever they consume anything that contain any mammalian tissue, not just the red meat, some of them could be allergic to dairy products, some of them could just be allergic to gelatin capsule, for example, and anything that may contain this alpha-gal, then their body could develop these allergic reaction. Could be from something that's as minute as hive, itchiness, gastrointestinal issue, all the way to difficulty to breathing. So there's a huge range of symptoms in this case. And really what we want to emphasize is this is not just a red meat allergy, but it is a alpha-gal syndrome that's allergic to anything that may contain any mammalian tissue.
Yeah, I wanted to lay that groundwork because I know there's a lot that goes on underneath the surface. So you mentioned the Lone Star tick, and it's the primary cause of AGS. Are there any other ticks or insects that could trigger something like this?
So AGS is mainly the problem in mid-state in US, in North America, but it also occurs in Europe and also other continents such as Australia and Asia and Africa as well. And in that case, actually, this Embryoma americanum, the lone star tick, is only in North America, while other continent has a different tick. So different ticks bite causes this AGS similarly. However, just in the case of North America, up to the current knowledge, researchers think this Embryoma americanum is the main causal factor. So we still cannot completely exclude other ticks as a potential problem. But what we know is the major tick in America causing the problem of AGS is lone star. So in other states, such as the state where this lone star tick does not exist, such as like North Dakota, very northern area, and also California area, they do not have this lone star tick, but still some cases of AGS occurs in a low frequency.
So I did a little bit of research on AGS before I hopped on today, and I read that less than 10% of people bitten by the Lone Star tick actually develop the disease or the syndrome. Is that correct? So some people that get bit by the tick develop it and some people don't. What determines that? Is that on the human? Is that on the tick?
Yeah, one of our research topic is related to that. Just why only a certain person develop this AGS while others are okay without any problem after tick bite. Yeah, obviously there could be two different reasons. One is a tick side and the other is a human side. So probably there might be some different tick exist and also difference in sensitivity in people happens. So far, what we know is when we do some experiments with the ticks, we find that individual ticks are very different in terms of the content of AGS in their salivary gland. Some tick has really high amount of those alpha-gal, which is the allergic elicitor in tick salivary gland, and some tick has a very low level. So we do not really know whether this is really some different tick, different regional, different seasonal. So current research moves on to that direction as well. And also in human side, some people appears to be more sensitive, and also some study has shown that a genetic factor might be involved in there. So we are currently working on AGS patient blood samples, so plasma samples, to understand more in depth of what kind of factor is involved in sensitivity to AGS as well.
Well, that makes me feel a little bit better, because before I even dove into AGS and what it is, it's been one of my deepest, darkest fears to get bit by this tick and not be able to eat red meat. So knowing that 10% or less have the chance of developing the disease makes me feel better about it. But because I'm a livestock production agent, ticks are a big topic. And depending on the time of the year, and I read a little bit about how this alpha-gal syndrome is increasing, especially in rural areas. Is that because the tick population is increasing, or again, is it on the human side? Our susceptibility is increasing. Kind of dive into that a little bit for me.
Yeah, answering to that question, we still do not know why it is really increasing in terms of the number of patients. One of factor obviously is just awareness. More people aware about this AGS, and that can be more easily diagnosed as a AGS by health professional. But that's not only the reason. There must be something possibility of real actual increase in number of patients as well. And in the case of Kansas specifically, actually, this Lone Star tick was not really the tick widely distributed in Kansas. About 10 or 20 years ago, Embryoma americanum was more on eastern part, like Kansas City, and only on the border with Missouri. And it has been expanded to further western and northern direction. That has happened in last 10 and 20 years. And we believe that the range expansion is continuously happening to northern and western area. So we explain that as a part of climate change issue. Potentially, the occasions of this AGS increase the AGS cases in Kansas may involve the range expansion of this particular tick as well. Yeah.
I want to add that I'm a hunter and gatherer. I hunt and look for mushrooms. And when I first moved to Kansas about 7 years ago, I don't even remember I saw a Lone Star tick. But then in recent years, I say last 2-3 years or so, half of the ticks I found on me are Lone Star ticks now. So there's certainly, just from personal experience, I certainly see a significant increase of population in Lone Star tick just in the Manhattan area.
Awesome. So I want to kind of shift the conversation a little bit to Dr. Chow, and I want to pick your brain about maybe some of the research that you're doing. And I read in an article that you are testing meat products with mice. So what have we discovered so far? I mean, I know that the whole purpose is to figure out how to reintroduce red meat into a person's diet. What does the reintroduction process of red meat or mammalian products look like to a person?
Thank you. Yes. So this project that we're currently working on is a 2-year project. And this is year one. And part of the year one's goal is to categorize, or actually quantify, the amount of alpha gal in different food products, like I mentioned earlier. And then another objective that's on the second year of this project really is my collaboration with Dr. Park, because he has this group of alpha-gal knocked out mice, so genetically modified mice that their alpha-gal has been removed from their system. So pretty much just like human. And so we're basically using them as human models. And Dr. Park has these ticks that he purchased from Oklahoma State. And we will actually extract the saliva out of these ticks and then literally inject them into these alpha-gal knocked out mice to make them get alpha-gal syndrome, essentially. And then we're going to feed them all these different red meat products that we have quantified the amount of alpha-gal that's in these products, and then feed them to these mice, and then record their allergic reaction, mainly through blood, to measure how much antibodies they have produced, but also we'll record that what kind of symptoms they have developed as well throughout this process. The goal really is to find out that what is the relationship of the amount of alpha-gal in food to potentially how a patient is going to respond to it. Like we mentioned in our previous interview, that the ultimate goal really is to help patients that are kind of toward the end of their alpha-gal syndrome. I guess I probably need to mention that most of the studies show that after 5 years of not getting bit by ticks again for alpha-gal syndrome patients, they typically see a decrease in their antibody production. And there is actually an 80% chance of them being recovered, or meaning they can start reintroducing red meat product into their diet. So I'm kind of focusing on that particular phase, is in that when the patients are deemed that they're ready to get red meat reintroduced into their diet, what are some of the products that can potentially be the first ones that are reintroduced their diet so it's safe and comfortable? We are in the process of quantifying the alpha-gal in these different food products right now. We have not started the mice project yet. So that's going to be happen next year.
So you're in the process of quantifying how much alpha-gal is in the meat products. So
yes,
are there are certain meat products that have a higher concentration? What are some of the ones that are high in concentration of alpha-gal?
So common knowledge is that all the organ meats have a significant higher amount of alpha-gal. In fact, organ meat like pork kidney, for example, is one of a product that we actually use as positive control. So typically meaning that it has really high level of alpha-gal. So currently we have quantified fresh meat product like beef, pork, lamb. We have also quantified some processed meat product like bratwurst, beef hot dog, cooked hamburger, jerky, bacon, summer sausage, deli ham. And what we have found is that cooking actually does not reduce the alpha-gal content. In fact, cooking further concentrate the proteins that may have alpha-gal on them, and cooking actually increase the concentration of alpha-gal in most of the product we've tested so far. What I have also found is that we have found products like summer sausage, which is a fermented product which has high acidity, that is more tangy. We have found that has lower level of alpha-gal. And we don't really know the reason why. Is it because of it's having lower pH due to the lactic acid production, or is just simply due to the fermentation process by the microbes? We don't know that for sure at this point. But if I were to say that high level of alpha-gal, you want to avoid organ meat, and then probably followed by typical cooked processed meat and fresh meat, they all have similar level. And then the ones that have really low, the lower level, probably half of what we have found for processed meat is summer sausage.
So essentially, to reintroduce something with alpha gal concentration into a diet, you would start with those lower concentrated meats. Are you planning to kind of work up and see how that reaction happens?
Yes, absolutely. We're trying to feed all of these different products to mice and see how they respond. Right now, we have a number, right? It's just a number of how much of this alpha gal on per micrograms of protein. It's a number. What does it actually mean? We don't know. So we're trying to translate this number into an actual reaction based on how the mice react to that. I mean, it is also possible that mice can respond differently to beef jerky or bacon, even though they have pretty much the exact same amount of alpha gal in them.
Well, that's pretty fascinating. I'm going to throw you a question here that's might be a little bit far-fetched, but my mind obviously goes to like, how do we prevent things like this? How do we control them? So is there any talk about a vaccine or something to prevent this in humans? Is that a possibility? Is there even anywhere to start with that kind of thing? Dr. Chow's laughing at me.
And I'm looking at Yongsen right now
Yeah.
because he's the one that came up with some of these ideas. So
Okay, so we came up with some of ideas. Just one idea is about dairy product. So in the case of dairy product, as you know, lactose intolerance the product has been developed for that case as a lactose free or low lactose milk. So we had the same type of idea, just whether we can reduce those alpha gal in milk by using some enzyme degradation. So we currently work on that part, and also that idea has been expanded just for possibility of utilizing some of pill containing enzyme that degrade this alpha. So still just some highly sensitive patients is not going to be able to utilize this type of tool, but some patient who has some low degree of symptom, such as like a gastrointestinal, like a little bit uncomfortable stomach after eating meat, in that case, type of problem may be solvable by using this type of tool. And the idea has been expanded, but just actually one of our activity, very important activity, is like for the patient how they really eat without meat. Just that is the topic of the study by Dr. Priscilla Brenes can say more about it.
Which leads me to, I'm moving to you next, Priscilla. I've got a list of questions for you. Because, like I said, I have on my extension hat, and all of this information is so awesome. And I'm learning more and more just sitting here with you guys talking about it. And obviously, in extension, our goal is to get this information and this resource and this research out to the people of Kansas. Take me through where you started. I know you started with an original survey to extension agents to just gauge the information and their knowledge on AGS. So, what were your findings with that? What did you see?
Yes, so we had 144 agents or extension professionals that fill out the survey. Most of them, about like 80% of them, said that we definitely need more information about this. There is not enough information. There is there is a need in Kansas to get some information out. And some of their comments were like, well, a lot of people don't know, health professionals don't know about this. This is a newly, like an emerging condition. So we definitely need some resources and education on that for the community. And they also said that we might also include there all tick-borne diseases, some education on tick-borne diseases, how to prevent them. And then, specifically to AGS, because that's our project. One of the things that I want to point out is that in extension, we want to create awareness, increase people's knowledge so that they can make informed decisions and they can live healthier lives. And in my area, family and consumer science, we focus a lot on, we are not helping people treat a disease or diagnose a disease. We're trying to create awareness on things they need to be mindful about, to maybe then talk to a healthcare provider about it. So if we create resources that talk about, how AGS can be acquired through a tick bite, how to prevent tick bites. Those are actionable lifestyle actions or changes that people can do to prevent getting AGS. So we are focused on gathering the challenges that extension agents have seen in the field, but then also now we have a survey that goes to the community because we also want to gather their challenges. And from our informational sessions that we've done in January, we've seen a range of responses from participants, like it is hard to date when you have AGS. It is hard to go to a potluck. It is hard to go to a barbecue. So we want to know those challenges so that we can equip extension and extension agents with some resources that they can provide the community to either increase the awareness of AGS, what AGS is, what are some things that people need to watch out for when they go to potlucks, because and Dr. Park can talk more about this, the sensitivity. If somebody is very sensitive, are they gonna be affected by the fumes of the meat that is cooking, or maybe they are not as sensitive? So like those types of things are what we want to create to increase people's awareness of things they need to watch out for, so that in the future, if they identify some of these things that they're happening to them, they can go and seek medical help in the case that they have access to that.
I feel like that's really cool because the resources that you can develop or can offer are not limited by any means. I mean, we're just not talking about a resource for people with AGS and how they live their everyday life, but going all the way back to how to, prevent tick bites, or how to be aware of how to prevent tick bites, all the way to, if you have the syndrome, how do you better live your life? How do you, happily live your life? Like you said, some people have a hard time dating or going to a potluck because they're nervous about, how they're going to react or how that reaction is going to happen. And I just find that very amazing that Extension's role in this is so broad, and the resources that you can offer people that have to do with alpha-gal syndrome is far and far beyond. So I know you have another survey coming up that you're planning on sending out. Am I right? Yep. So
yeah, we have it out. Yeah,
it's out now. So tell me about that survey, what exactly it's asking, and how you're going to use those results.
Yeah, so we're asking about people's knowledge on AGS and if they know somebody in their county. Because one of our goals is to use this information, and even though it's self-reported, these are not clinical cases. We can see, like in areas, what are areas that may need more resources because more people are reporting that they have alpha-gal or they know somebody that have alpha-gal in that county. So one of the goals for our survey is to share our results with the Department of Health and Environment, and maybe they can allocate more resources to these areas or just start to investigate this more, so that in the future that this may become a reportable disease to the health department, so that we actually have clinical cases reported by clinicians that can identify how spread this condition is in Kansas. We're also asking about their challenges. We're asking them if they are using any resources at all to manage their condition in the case that they have AGS. What are those resources? Because we want to check those out. And we're also asking them if they have AGS, if they will be interested in participating in an interview. So we right now have a lot of people interested in participating in the interview. And in that interview, we want to know more about their challenges, because there's so much that people, write. But when you start having those conversations is where you can really know people's story and how it all started. Because we've had participants from our listening sessions that say, I've had this for 20 years and I was just diagnosed a few years ago. So, we want to gather those stories as well with our surveys and with our interviews.
That just kind of makes me realize, so a lot of people can have this syndrome and not even know it.
So far, actually, some of scientists has been studying those more clinical point of view of AGS quite intensively. And most of the cases, diagnosis is very difficult because Yeah, first of all, those blood specific IgE against alpha gal is the major tool to diagnose, but it is not really false proof. Sometimes some patient appears to be having low levels of this particular antibody. So in that case, those people need to have more accurate tests, such as like other allergy, like a skin prick test, as well as some experience there. So there are a couple of like a typical symptom that can be called as an AGS patient, but still like summing up multiple symptom is required to make a definitive conclusion.
Is there anybody, I know Priscilla, you mentioned the Department of Health Services. Is there anybody that has collaborated with you guys or shown interested in this research project like Department of Health Services?
I can add on to that when I was writing the proposal, I did contact the Department of Health, and their epidemiologist did say that they're very interested in collaborating with us. And so they actually share with us their website. Alpha-gal syndrome is definitely on their radar. It's something that is increasing its prevalence in the state of Kansas. So what we have actually talked about is that we're creating a website and then they're creating a website. We're trying to gather information, but linking the two websites together. So this way that we're not duplicating resources and efforts, but at the same time, when patients are trying to understand maybe, let's say, the database on content of AlphaGal, they can come to our website and then we can link it to their website to show them, okay, this is the number of positive cases of alpha-gal syndrome in the state of Kansas, or this is where you can find trained allergists that know about alpha-gal syndrome. So we are collaborating on that end on having two Kansas-based websites, but not duplicating that information.
Awesome. So we're going to get to the end here. I have like two more questions and one that's probably pretty broad, and you guys have touched on it throughout the podcast and throughout the episode, but can you kind of wrap up like your long-term goals of this research and helping AGS patients? You know, what is the end goal for you guys? Just kind of your main long-term goal for each of you.
At least when we were talking about this particular project, we are thinking about, we want to really use the data from this particular research and to establish some form of a alpha-gal research center in the state of Kansas, and to really get the attention from the state government. So they are really paying attention to this particular allergy or disease. For example, is that we can have inquiries coming in on, okay, there's a new food product that's being developed, and they can come send samples to us, and maybe we can test the amount of alpha-gal in there and provide some forms of alpha-gal free certification maybe, and to show them that, okay, this product is certified alpha-gal free. So then they can advertise it maybe as alpha-gal free. And then of course, we want to be able to allocate more information and resources to the different locations that we have demonstrated has a much higher prevalence of alpha-gal syndrome, that we can have these posters as well as informational sheet being distributed, no matter it's at clinics, local hospital, or even maybe retirement community or school. And we have a team that can go over there to actually present these information to people in that general area. And of course, listing out allergists in that general area that know something, or maybe not even allergists, just doctors in general know something about alpha-gal syndrome. So people in that area, when they are suspecting they may have alpha-gal syndrome, they don't have to go through 5 or 6 different doctors to actually get diagnosed. We want to establish ourselves as a center that is at least the goal when when I was writing this particular proposal?
Longer term goal than just in addition to the current project, what we are doing is like what I told you. There's one side, just we would like to have some solutions, such as like the alpha free dairy product, and also some pill that can be taken care of low levels of symptoms. And in addition to that, actually, the basic problem, in my view, in the study of AGS is still diagnosis, and also there seems to be potentially subcategory of AGS because just most of all, there are really large spectrum of patient symptom we find from very sensitive to some levels of tolerance we find. So just some more accurate diagnosis would be the best way to combat to this AGS. So I'm currently working on that aspect, and also for all these knowledge, actually we cannot really separate cancers. Like what Dr. Charles said, cancers can be one of the major role we have, but we work with national level, some other states such as North Carolina and Kentucky. We are working with some scientists in that area to make the data not really biased only in Kansas, but also we try to understand some national level of problem.
For the extension side, I would say to start creating that awareness and education for people, whether it is on helping disseminate the results from Dr. Chow's research on the amount of alpha gal in each food product, or Dr. Spark's research with the mouse model. Disseminate those results, increase the awareness of people, the education, so that at the end, Kansans can be or can make decisions that are more informed and that are going to help them thrive, as it is part of our mission here in Extension.
Awesome, which leads me to my last question, and this might be more for Priscilla, but what can we do to play a role in educating our communities on AGS? And then if I'm somebody who either has AGS or knows somebody who has AGS, is it beneficial for me to reach out and, be involved in this research?
We actually have a AGS website housed in the entomology department, and we are updating that website to provide more resources for people that have AGS. You can find our slides from our listening sessions. You can find our webinar recording. You can contact us through that website as well if you have questions, but also in the future, we will have more resources for people that have AGS or anybody that wants to create awareness, whether that is with a support group or an extension agent as well.
Awesome. I feel like I have learned so much today and really am excited about increasing awareness and pushing that information out to not only just my small town, but my communities, my district, everything that surrounds me. So I want to close out today by first saying thank you to all three of you for hopping on and joining me today. This is a topic that I have always found super interesting just because I do live in a rural town and ticks are very prominent here and has just been something that's always been in the back of my mind and a small fear on my part. So thank you guys for sitting down with me today and recording this episode. For anybody who's listening, I will be linking the AlphaGal website that Priscilla referenced in the bottom of this episode. So if you are curious or you have questions or need to be in contact with somebody related to this project or alpha-gal syndrome in general, you can go to that link below. Again, if you have any questions about this topic or any extension topic at all, you can always reach out to the extension office. You can call both offices in Ottawa and Saline County, or you can visit our website at centralkansas.k-state.edu. Thank you so much for joining us today. We appreciate you being here. We appreciate you learning and listening.